Okay, I will continue.
Okay, they're entering the main room.
Mm-hmm.
Cool.
Nice. I'll just give a couple of minutes for people
Yeah,
to come in.
welcome.
Hi, everyone. So going to Instagram this right now. That's so cool. Cardiff University. Woo. It's all the crew guys. So exciting. Honestly. Yeah, just hear my voice. Just don't worry about that. Cool.
Yeah, Lucinda, I think you turn your camera on if you like to.
Oh, can you not see me? Oh
Yeah,
my god. Oh yeah. Oh my gosh, I'm so sorry.
No worries.
So bad. Can you see me now?
Oh, it looks a bit dark.
Yeah,
Is it a bit? Yeah.
Yeah.
Oh my gosh. Okay. I can't even. I didn't even know what I look like. Like I can't even like. I know I can't. I literally can't. I can't see myself. Let me see. I don't know if this is
Oh, that's
going
yeah.
to.
We can see it now.
That's right.
You can see it.
Yes.
Okay. Cool.
Yes.
Excellent.
Okay.
All right.
Give like the
see.
participants another like 1 to 2 minutes while they come in.
Sounds good. Cool. I literally can't even I can't even see myself. So I don't know. I might be at a complete angle, by the way. So apologies for that. Oh, did you are my slides on your email at all?
Oh yeah. No worries.
Yay! Fantastic. Thank you. That's
Oh,
great.
should I send you my slides as well, just to distribute to people if they want to get more information?
Oh yeah, but we can do that at the end of the webinar.
Yeah.
No worries.
Okay.
You sound very informative.
No, literally, I just copy and paste the websites for people to just click for more details.
Oh, that is helpful. Yeah, definitely. Yeah.
Searching for these things can be a bit annoying when you don't know where you're looking, to be honest.
Oh, 100%. Very good.
So how many people do we have linked into the webinar at the moment? Is it 184, or is that to people people trying to get in?
Oh no, that's just 184 people inside, like
Already inside.
already inside.
Okay.
Yeah. The response rate has been quite good actually. We've received like over 400 signups.
A lot of people were interested.
Yeah.
So these are the lucky ones here.
These are the chosen people. Oh, it's so nice to see so many people come on though. This is amazing. Honestly. How many people are like in a year group these days?
Oh, like in a typical year group, say for example in Cardiff, you have about like 300 students, 320.
Cool. And I'm assuming this has been opened up to like all year groups then, or?
Oh, sorry, you mean, yeah, this webinar was advertised to like all year groups. So it's not just within Cardiff students, like we have students coming from like different parts of the UK. So we have students from Edinburgh, Glasgow.
No way.
Yeah.
All over.
Oh, how exciting.
Even
Other countries as well.
Yeah.
No way. That's
outside
so
the UK,
exciting.
so.
Wow. Oh, that's brilliant.
Okay, yeah, I think we can start right now because it's already 6 minutes into the time.
Fabulous.
Okay, so let's begin right away. Right. As we go, Amanda, you're happy with just admitting people in? Okay, great. All right. So welcome everyone. Welcome to our first webinar of our webinar series called Applying for Overseas Training Programs, the UK IMG Guide. And this is a webinar brought to you by CHIPS with the support of two organizations which has kindly helped us out in recruiting speakers as well. And those two organizations are MMI UK, Malaysian Medics International, and SMSUK, the Singaporean Medical Society of United Kingdom. Right. So we're all very, very happy to have you here today. It's been incredible to see so many signups from just different parts of the UK and even across overseas as well. We have received signups from Northern Ireland, from Europe. We have some signups from Malaysia as well, and from and even from South Africa. So it's really a group mix, and it's really nice to have all of you here today with us on this wonderful afternoon. So for today's webinar, we'll be covering about the overseas training program in Australia. And we have two wonderful speakers here with us today. We have Moses and Lucinda. Who'll be covering, oh yes, we'll be covering a range of topics, on how do you apply, especially as a UK graduate, how do you apply through the competent authority pathway, and that will be covered by Moses. And for Lucinda, what she'll be covering is basically how is it like to be a doctor in the UK and in Australia, because she has gone through the whole process herself, and I'm sure Lucinda has a lot to share based on her experience. Okay.
Totally.
Yeah. So just a few housekeeping rules. Number one, this webinar will be recorded, so just keep in mind of that. Number two, if at any point during the webinar you do not have to wait for the Q&A session, just at any point of time, if you have any questions at all, please feel free to drop it in the chat box. We will try and answer all of the questions, though in the interest of time, some questions may be, like if there are any similar questions, we may skip past them. And if there are too many questions, obviously we may not be able to answer all of them, but we'll try our best to answer as many as we can. Number three, please remain muted at all times. Do not share your video, do not share your screen, and please be respectful to the speakers, especially when they speak, and just no inappropriate behavior as you go through the webinar. Right? So just a couple of things to keep in mind. And without further ado, I think we can start right away. And I think our first presentation today will be by Lucinda, talking about the difference talking about the life of a doctor in the UK versus Australia. So just before I pass over the slides, just before I pass over the baton to Lucinda, I'll just give her a brief introduction. So Dr. Lucinda is a general practitioner who has completed medicine at Cardiff University and did her foundation program and GP training in Wales. In 2019, she made the move to Sydney to see what life was like on the other side, and is currently working as a GP with a special interest in skin cancer medicine and surgery. She has documented and shared her journey on Instagram and YouTube for all of those who are thinking about the move. So over to you, Lucinda.
Cool. Hey everyone. So fellow Cardiff graduate of 2012 here. Can you actually see me? I have no idea.
Yep, they can. Yeah.
Or yeah, you can. Cool. Okay, so basically, because I can't see the slides there at the moment, are they going up at all, or is it just on the CHIPS one at the moment?
Oh, wait, hold on. Yeah.
That's cool. So yeah. So as Seth said, so yeah, Cardiff graduate, did all my training and everything in South Wales. I basically heard a lot about working in Australia since medical school. So people always talked about how people would go there and they wouldn't come back, and that always fascinated me. There was also another part to it where I actually originally wanted to do pediatric training. And they always said, oh, if you just do a year of peds even in Australia, then you'd be accepted into peds training quite quickly in the UK. So there's lots of things which I thought, gosh, why is it so good? And then I went into GP training just because I just like a bit of everything. And then I made my way out to Australia because I wanted to understand why it was so good. And actually my hidden agenda was to try and sort of like figure it out, because I was so sad that so many doctors were leaving. So I wanted to figure out so I can bring it back home to sort of make life more like, I don't know, just to make work better somehow back home. But I found myself really enjoying work here, and there's loads to it. So it's so complicated actually when you go to think about sort of the differences and things. But hopefully I can help you understand things a little bit better. So essentially, yeah, that's the why Australia. The how is I found there was an agency in a GP conference, so I just used them basically to apply. I then sort of just decided, okay, where do I want to live? I came here on my own, so I chose to go to either Sydney or Melbourne, just because I really like a city kind of life. And especially being on my own, like, it was a nice thing to do. I chose Sydney in the end because of the type of job that was available to me. So I was looking for a big practice to work in, because actually in Australia, it's very common to have super practices where you've got radiology, where you've got specialized clinics involved, like basically almost being able to do like an emergency medicine type of healthcare. And you're having everything on site, so it's quite satisfying. So I found a practice that did that, and another big thing for me was to be able to do Indigenous work as well. So so I found a practice that I was able to do that. The entire process took about 10 months from the point of applying to actually getting the visa, and it cost about £5,000 to like go and do it all, and it involves lots of paperwork and lawyers and also doing some assessments. I think there's a lot more assessments now though than to when I did it like 2 years ago. Not a ton more, but enough just to sort of like make you do a bit of extra work. And then I arrived. My practice was really nice. They set me up in a free accommodation for 2 weeks, and they hired someone to show me different accommodation to try and live. So anyways, that was like the process. So it takes time and it takes effort. So you've got to put the effort into it. Now the practice that I'm working for, it is a huge team. Like I said, so we've got X-ray on site, we've got ultrasound on site. We've got like a big team of like mental health workers, physio, podiatry. We've got Indigenous healthcare workers. We've got occupational health staff. There's like a lot going on basically, which means that your work is very, very diverse. So I don't know how many of you have done general practice as a placement yet, or even been to a GP surgery yourself. Like I guess you kind of know what to expect. But it's a big difference. So I'll go into that in a bit. But like, if you can see on my first point, it's a mixture between public and private healthcare, which obviously coming from the NHS is a big shift when you're used to everything being available on the healthcare system to there being parts where it's not. It can be really challenging at times. So for example, not all medications are subsidized by the government. And by that, I mean, like, you still have to pay a fee. And with a lot of medications, even like things like the contraceptive pill, it could cost like $80 a month, which is like about £40 a month. And obviously everyone's used to like not having to pay for it. So if they can't afford it, you can imagine how that can be a bit of an issue. There are certain ways around it slightly. If you qualify for something called like a healthcare card, but you have to have certain medical conditions or earn a certain wage, it's not like as straightforward. So there are times where patients can't afford medications, where they cannot afford to see specialists, and then they're just caught in this really difficult loop where I think one of my more difficult cases was when someone had a really bad infection. They couldn't afford painkillers, they couldn't afford the antibiotics, and he almost lost his leg, and it was really, really, really hard. So like, he didn't qualify for a healthcare card, so that was really difficult, but it doesn't happen often. So there's that. Also, all GP surgeries are basically privately owned, so you haven't got like a GP partner essentially that's owning the practice and then running the scene, although there are GP surgeries like that. So my GP surgery is corporate one essentially, but they do a really, really good job. And that also goes for specialists. So specialists are also like private as well as public. So for example, the classical specialist that I struggle to find anyone that's like NHS equivalent is ear, nose and throat. Like I'm really struggling to find anyone that does that. So it can be a bit of a struggle for patients who don't have private healthcare. So there's that. And then from a practice structure point of view, like I mentioned, there's lots of different type of people within the practice. So it makes it really good, like as a multidisciplinary team. What I can add to that as well is that there are specialized clinics. So for example, every week we've got a geriatrician on site, we've got a psychiatrist on site, where we do case conferences basically about patients. We did have a gastro. It just sort of varies as to like what specialists we've got at the time. So that can be really helpful. Then the time. Okay, so we're used to general practice being open like Monday to Friday, decent hours, right? So over here, it's totally different. I know some practices that are open till 10 p.m. I know that is late, right? But mine, for example, is open 8 till 8 on weekdays and 8 till 6 on weekends. And I, yeah, absolutely work weekends. I don't know, it just feels like quite normal to do that now. So I've got like a 40-hour week. I have 2 days off one week, 3 days off another week. And I don't know, it's like, it suits me quite well. Like, and although I work more now than I was in the UK, because I was locuming back as a GP in the UK. I just feel like a lot less stressed. I'll go on to that like in the work-life balance section. So yeah, those are like the hours. But also when you've got patient appointments, so in the UK it's like 10-minute appointments, pretty standard, whereas here you can kind of choose what kind of appointment length time you want. So standard here is about 15 minutes, but I have colleagues that have 20-minute appointments, sometimes even longer. You can slot in your own break slot, so you just control your time, because essentially in this country, the money you earn is dependent on the work that you do. You're not paid per hour, you're not paid per day. So it's in your interest for you to like, you know, work as much as you can, if that makes sense. So you have a bit more trust from your bosses. Okay, now we're going on to access to investigations and treatment. This has been massively satisfying, being able to, for example, have X-ray on site. So if I'm worried about a fracture or, you know, I don't know, acute abdo obstruction or something, I literally just send them straight to X-ray and I can view the images on my screen. And that is something that is, it's so helpful. And even like having someone with a possible miscarriage, I'll literally just like take them around to ultrasound. Like, because sometimes they're not even with the partner, obviously, because you know you don't plan these things, and I can literally just be there whilst they're having their ultrasound scan done, and like you have like an immediate answer. So that kind of care is so good, and it's so nice to be able to have that. So it's very satisfying in that way for the patients and for the doctor. Also things like bloods, access to different kind of scans. Like there hasn't been an investigation that I've not been able to access. In the UK, I got quite frustrated at times, like, you know, because of one, waiting times for investigations. So working in Wales, I don't know what it's like elsewhere, but like an urgent was up to a month wait, a non-urgent was up to 3 months wait. So pretty challenging. Whereas here, you get the scans basically on the same day. And with the types of scans, like I actually don't have to speak to a radiologist about getting their permission to request a scan. So I can get MRIs, CTs, like echoes. I can literally request whatever. And it gets done pretty much the same day, if not that week. The results come back the following day. So it's very, very quick. And then when it comes to treatment, I have access to more treatment. Don't worry, I'll get to pay in the pay section. So I just saw that comment there. So yeah, I have access to more treatment. So I can prescribe like, I can prescribe so many things. I'm treating hepatitis patients. You can treat HIV patients. It's basically whatever you're comfortable and confident doing, you can do. So for example, we have a drug and alcohol detox clinic, so you can, you know, prescribe all of the drugs for that. It's really like, it's literally like proper world is your oyster kind of situation. There's pros and cons to that though, in the sense where you almost feel too trusted, so you can get some rogue GPs. So I think the worst situation I had, one of the worst, was a patient who came to ask me for some diazepam to help her migraines, because that's what her normal GP does. And I was just like, well, that's not okay. So that can happen. Anyways, going on to then, so specialists. So I think like with that, basically just saying sort of like with specialists, it can be really difficult to know who to refer to because not all of them are public billed. So some of them, like a lot of them are actually private. So that can be quite challenging if the patient doesn't have a private healthcare. Now, special interests, as Seth mentioned, I have a special interest in skin cancer, which is so cool. Like, I did not realize that I would be able to do like skin cancer medicine and surgery. So I did a course briefly in the UK, and then I did another course in Australia then. And so now I'm like doing skin clinics where you check someone top to toe for like skin cancer, doing biopsies, doing skin cancer excisions. If I diagnose a melanoma, I personally don't remove them, but I know plenty of GPs that do. So it's just knowing what to do, and you can do a diploma then in it if you wanted to get really good. That's something to think about. You know, then you've got the, like I mentioned, drug and alcohol detox. You've got the standard women's health clinics. You know what was really cool I found out recently? They used to do PRP in my surgery, so platelet-rich plasma therapy. They've like literally, you can do so much. You can do like cosmetics, like literally there's loads of different things you can do. Then teaching and research. So like I've already been teaching medical students, which is absolutely incredible. I didn't have to go and do any extra training or fill in anything. It was just like, hey, are you up for teaching medical students? They'll fit in place with the years. So yeah, just did that straight up. When it comes to research, what's so interesting is one of my colleagues that's actually just joined the practice. He's just gotten a research job without any sort of background in research. And he's going to be one of the doctors that helps with the COVID vaccine clinics, which is very, very interesting. So can you have a special interest in pediatrics? So you can have a special interest in basically anything that you like, I feel. Like it just, but I also feel that that's possible in the UK. You just have to work a lot harder for it in the UK. So for example, I really was interested in having like a special interest in possibly peds or anything like that back home. And you can do it, I feel, if you've had jobs in that sort of sector back home in the UK. So you just do your GP work and then you can do your outpatient community peds clinics as well in the UK. So it's possible. So yeah, so that's when it goes to that side of things. So I hope that answers a bit. If not, you can always ask a few more questions. Now we're going to work-life balance. And so, like I mentioned briefly earlier, although my hours are like a ton more than what they were like in the UK, I'm actually feel a lot less stressed out. Like back home, I felt absolutely exhausted. Like just psychologically exhausted. And I don't know if that's because of 10-minute appointments. You really struggle to get a break as a result. The patients, they're really stressed out because they waited so long to see you. And then, you know, like me, I run late. That's just what I do, because I do take my time with my patients if needed, and you have those ones that really do need sort of more extra time. But patients are a lot more chilled out here, basically, which is very interesting. And I always felt like it was very sad, but I just felt like I used to spend quite a bit of my time, first of all, apologizing to patients for the wait, and then sort of like the fact that I might not be able to cover all of their problems because it's only 10 minutes, of which it's now 6 minutes, because I've spent the rest of the time apologizing to them. And also, like, I feel less passively aggressively threatened by patients. It sounds terrible, but people are just super stressed out, basically, and so they feel like it makes them feel like they're going to complain about you a lot. But anyways, what I should mention is that patients in Australia, they can go to whichever GP surgery they want to, so they're not actually sectioned to one GP. They can go wherever they want, so everyone just sort of like, you know, it kind of makes you be on your best behavior, because obviously you need your clients in order to make an income. So I don't know if that improves GPs like interaction with patients, maybe, but anyway, so maybe that sort of helps a lot as well. So yeah, when I say control of time, what I mean by that is that you can control the amount of time that you have with your patients. So by having that, there's that element of trust, so with your patients as well as with your bosses. So you don't feel like you're failing if you don't meet that sort of 10-minute mark with your patients, because there's an element of that in the UK where it's like you just need to work better rather than recognizing that people do need more time. Then, so yeah, like I mentioned, work's less stressful because of like the way the patient's mentality is very chilled. So like I literally cannot remember the last time I've needed to talk to a patient about why they don't need antibiotics. Like when I say to a patient here, look, you really don't need antibiotics for this is viral, they're like, oh, thanks doc, I'm so glad that you don't think I need antibiotics. I'm just like, I normally spend 4 minutes trying to convince the patient why they don't need antibiotics. Like, oh, so it's a different culture basically. And then, like I mentioned, the variety of the job that really keeps my interest going. Like being able to cut out, like just block off like half an hour slot for just like skin surgery. It makes me so happy, and just being able to see those X-rays on the screen. I don't know, but that's just me. That's not for everybody. The weather. Honestly, I did not think that was going to make a difference, but it really does. Like, I remember back home, it was so dread because I was just like, oh my God, it's sunny now. And like, I can't remember the last time I saw the sun and I'm working. Oh my God, I'm not going to see it again. And it really does make a difference. But guys, literally, I'm not even joking, it's hot. It is hot here in summer. There was ash falling from the sky this summer, and I was told that was like a once in a blue moon thing. The bushfires were no joke, and it was scary. So yeah, heat is something to think about, but it's lovely that it's sunny a lot of the time. Also, cultural generally in Australia is very chilled out. People are super chill. Yeah, I don't know why, but they're lovely. And also like there's lots of nature kind of things to do here, so I don't know if that is your kind of scene. Obviously it's not Europe where you've got that beautiful amount of history and culture to see in that way, but here it's more nature driven. So that's sort of like pros and cons from that thing. What's the next slide? Okay, cool. Pay. So this is what everyone wants to know about. So as we all know, there's like 3 main ways of which you sort of get work in the UK as a GP. So it's salaried, of which it's kind of like around the 80 to 110 benchmark for a salary per year. And then there's partnership, which is like above that pretty much. And then there's the locuming, of which you earn like really good money. Like you'll be earning about like 110 possibly, maybe more than that. So it all varies about how much work that you do. Whereas in Australia, so basically like you can locum around, and you can sort of be in sort of like different locations. So if I just go on to like, yeah, how the job thing works. So you can locum, you can work in the central district, but you can only basically work in a GP surgery for 6 months at a time, because what happens here, this is really important for everyone to know, because if you're looking to work in Australia, this is key, and it is a little shortcut to help you with your journey. So there's something called the 10-year moratorium. So the moment that you start work in Australia is like the time of which like you start having this clock that ticks down from 10 years. And after the 10 years, you are then allowed to work in whatever part of Australia you want to. And as far as I'm aware, this is just like only for GPs. It doesn't, I don't think it applies to hospital doctors, but I'm not entirely sure, so don't count me on that one. So for example, what I could have done is after my FY1, I could have literally worked in Australia for like a month, and then come back, done my FY2, done my GP training, it's already a couple of years cut off, and then come back to Australia after all of that, because you don't need to be in the country for that clock down time to go through. So I can only work 6 months at a time in a central GP surgery in a central city area, until like the 10 years has gone past, and then I can work there again. So the place that I'm working at the moment is in the outskirts of Sydney. And so I can work there as long as I want. That's fine. It's about like, if you're taking the train, hour to hour door-to-door commute. So I'm kind of used to that kind of commute anyway, so it's fine. So that's the way in which it works. Now that I've talked about that, let's talk about pay in Australia. So as I mentioned, you get paid for the work that you do. Now, obviously, you're not going to have many clients at the beginning because people don't know you, and plus they're super used to like doctors, like British doctors leaving like quite quickly, so they can be a little bit hesitant to sort of like stick with you, if that makes sense. So it all just depends on how you feel and what you say to them, obviously. So for the first 6 months, my practice agreed to give me a guarantee of 4,000 per week if I hadn't met that. And then after that, obviously, 6 months should be enough time for you to have a regular group of patients, of which totally is. I found around the 8-month mark, that's when I get fully booked. So that was good. So like, the thing is though, at the moment, COVID has changed everything. Some GP surgeries have had to like even shut down. Some have had to reduce their number of staff because of patients being very reluctant to sort of come in. So you can imagine in the NHS, that is extremely secure. Like, you've got a fixed salary, no issues. Whereas here, it's been like a major issue in that sense. We've been very, very lucky in our practice because of multiple reasons, because we're a super practice, but we also opened up a COVID clinic. Which is amazing. So it's basically where we've got patients coming through, and the nurses do, like, we've set up this entire like screening program. We did it alongside the government. Really cool. Don't know if we would have been able to do something like this in the UK. And so nurse take a history, doctor then sort of confirms everything, make sure the patient's okay, doesn't need any kind of treatment at all, get them tested, and then they're out. So it's like kind of like a 0-point contact. If you need any contact, you've got PPE involved, so it's okay. Anyways, sorry if I'm speaking really fast. I'm really conscious of the time. And so my salary at the moment, I think like it really varies, because like it can go anywhere between like 3.5 to like 7. It just sort of like jumps depending on like how busy and the type of work you do, because the way in which you bill patients as well. Okay, this gets a little bit complicated. Forgive me for this. So after you see a patient, you bill Medicare. So Medicare is basically like the NHS. So you bill Medicare, the consultation type and length. And then if you do any sort of special procedures like an ECG, pregnancy test, or if you've done skin cancer removal, or if you've removed a foreign body, like whatever, from an eye or a nose or anything like that, if you've done an incision and drainage of an abscess. So these are all things that you can bill for. And so, yeah, so it fully depends. And there's also things like healthcare plans, where you've got a general medical care plan, where patients with chronic diseases can then access like a couple of sessions free per year by an allied healthcare professional, or you've got a mental health care plan where patients can access sort of reduced fee of psychologists and stuff. And so, yeah, so those things all sort of like add up. And I know this is like a lot of information to take in, so I do apologize in advance. I have got like some YouTube videos on this if you want to sort of like have a little look into that as well. But that's essentially a big summary of everything. And I know I wouldn't have covered everything. So if you have any questions now, I think like probably, it's basically Today with Dr. Lucia, or LUCIA. So that's just like my Instagram, and where you can just see me doing my normal day-to-day weird Australian stuff, as well as like some doctoring things and like a typical clinic and everything. And then YouTube is kind of like a mixture of stuff as well, so that can be helpful. I saw a couple of questions on there where they were saying about exams. So in in Australia, the UK degree, medical degree and GP degree, it's any specialist degree, basically medicine related, it's all accepted. So you don't have to do an additional exam. So that's great. That's a big reason why I chose it as well, because doing another exam totally wouldn't appeal to me. So thank you for listening to my rambling. Oh my God. So I used Wavelength. I am not sponsored by Wavelength, but I really enjoyed their experience, because the thing is, guys, the application process is a complete minefield. It's complicated. To do it on your own is not impossible. There are websites out there to help. Trying to remember them off the top of my head. Is there an additional exam if you're in IO? I can't. I don't know. Does the agency help you apply for FY1? Oh, I'm not sure. Do you know what though? I would totally just have a look at, if you type into Google or whichever search engine you choose to use, UK to Australia doctor jobs, then just have a little look, and there'll be plenty of agencies out there. But I personally use Wavelength, and I thought they were great, really professional. Any other questions? Don't be scared to ask. Hopefully I'm not that scary. Okay, I'm trying to how can I maximize this? Oh, excellent. So as a GP, what would be a typical maximum salary you get yearly? Look, I know GPs that earn 10K dollars per week, but they've been here for 8 years, and they do things like occupational health as well. So basically you get people coming in for medicals, and so yeah, and that gives you money. Do you think you'll come back to UK? Guys, what I've learned about life in general, this is general life, this is a general life thing, is that I don't plan my life anymore because it never goes to plan. Is it suitable to move to Australia after FY2 or after completing specialty? Literally, look, what I would do, guys, is that just to help you with this tenure moratorium, if you need to, I would definitely just come and work here for a month. Try and feel the vibe. If you're interested, just come here, work, visa, holiday, just do it, just to experience it. It's so much fun. Most lucrative GP. Oh, there's so many questions. Speciality training in Australia, especially good for. Look, one thing I have to say about speciality training is I've met GP trainees and they're really good. I have to say, however, that the UK degree is highly respected here, and I really feel UK doctors have a really high evidence-based approach, especially when it comes to medications, because the way in which we do things I feel is very different, because we've got a very systematic approach that's very obviously evidence-based. NICE guidelines are amazing. I can't access NICE CKS guidelines, which hurts. It's just not allowed, basically. So anyways, how easy is it to find to settle in? Oh my gosh, I don't know. I'm quite an interactive person, so I'll try and make friends in whatever weird situations that I can possible. The weather was a challenge for me because I can't deal with heat very well, and I didn't own any summer clothing. But the actual settling in, it was absolutely fine. I think work made it really easy. Most of my colleagues actually at work are from the UK, which is really quite funny. Can you move after Zoom? Okay, can we join the GP training without citizenship? Okay, yeah, you can join GP training, but basically what one of the GPs told me here is that if you don't have citizenship or PR before you start medical school, and that has to be in Australia, then you still have to do this 10-year moratorium thing. Just an FYI, but yeah, you can do GP training. Is it really competitive? Oh, I don't think so. I think they're looking for doctors because they've actually not got that many Australian doctors. They've just increased it now, which is why they're kind of reducing the amount of numbers technically going into Australia. So if you wanted to, I missed that one. If you wanted to just work for a month to get a head start on the tenure order, would you still have to go through the agency? I think in order to find a job and to help you get a visa, it wouldn't be a bad idea. I didn't have to pay the agency anything at all. So that was the employer's thing. What would you do? What do you do when you're not allowed to work in the central GP surgery during tenure? What do you do? So I'm not sure what that question is, because I'm just working in the GP surgery where I can work long term there. So is the quality of life in Australia better than the UK? Look, guys, what I've learned about actually coming to Australia is that you're only limited by yourself. There is so much to do in the UK, nature, just cultural things. You're surrounded by Europe. Obviously, it's hard to travel at the moment. But you have so much, so you just have to make the most of wherever you're at. You mentioned just going to Australia from, I think I read, do you recommend a website or contact to apply? Look, for getting a job, I generally just, I would just search engine UK to Australia, doctor, jobs, and literally so many things will come up, but I use Wave, like I said. Would I need to go through an agency if I was an Aussie citizen, but want to do my intern? Ooh, I don't know about Aussie citizens. I'm really sorry. Do you know what? If you're looking into this, APRA, which is the equivalent of the GMC here, so AHPRA, don't know what it stands for, please don't ask me. But basically, yeah, look onto their website. They literally will answer so many of your questions if you Google them. What's the name? Okay.
Sorry.
How? Go on, yeah. I know this is probably right over way of time.
Yeah, because I understand that there are a lot of questions coming in, and like it's really great to see a lot of people asking questions. I think because we have another presentation to go on as well. I think okay if you just take one more question for this time, then after that we'll move on for Moses to have his talk. Is that okay?
I think that's yeah, of course. No, definitely. Like there's a lot to go through, and you can always
because a lot of
my Insta story.
Yeah, a lot of questions and you like how to apply and how to be a competitive IMG. Those will be covered by Moses. So like we can move on.
Oh, there we are. Perfect. So that's the thing. So would going to Australia for elective count towards starting? No, you have to physically work there, I believe. So, and how did you start working in skin cancer medicine alongside doing your GP work? Well, I had a colleague that was doing skin cancer medicine here as well. So basically, like he helped me out as well. But essentially, you just have to prove that you did some form of course. So it's not a diploma, it's not anything like that. It's literally just a course. So it was really simple. So yeah. Anyways, guys, I want to say thank you so much for everyone who's come today. I hope that this was helpful. I know that it's a lot of information to take in. Like I said, you can like get in touch with me, you know, pleasure. You can get in touch with me through probably my Instagram page is probably the best thing. So just message me any kind of questions. I'll do my best to get back to you as soon as I can. And yeah, I just hope you found this useful. It's just an intro into Australia, just like through an eyes of a GP that's done it. So yeah, I want to say thank you again and good luck with all your medical school degree. You'll be fine, I promise. And yeah, and thank you for having me, Seth.
Thank you very much. Cool. For those of you who don't know, like as she has mentioned, Lucinda is currently in Sydney. So I think it's midnight, right, on your side there? Yeah. So I think.
Oh my god, yeah.
Yeah, so
guys, I literally go to bed at like 10 o'clock. I'm such a granny. So yeah, this is yeah, you have my heart, Cardiff, aliens, yeah, and everyone else like who's in the university, not biased. So yeah, but it's been a pleasure, and thank you again for having me. Wonderful.
Right. Okay. Thank you so much, Lucinda, for the incredible talk. Right. Right. Have a good night.
Take care, everyone. Bye. I don't know how to exit. Okay, bye.
Okay. Right, yeah, so that was our first presentation by Lucinda. For those of you who have not caught what she has said, so Dr. Lucinda, you can actually reach out to her on Instagram or on Facebook. She goes by the account name of Today with Dr. Lucia. I'll just type it on for you guys. So for those of you who want to reach out to her and ask more questions about just how it's like to be a doctor in Australia. Okay, so moving on to our next presentation by Moses. I'll just give him a quick intro and then Moses can go straight into sharing your slides. Okay. Right, so Dr. Moses was originally born in Zimbabwe and moved to the UK in 2001 at the age of 10. He lived in Ealing, London and went to high school there. Since then, Dr. Moses has gone through, he has done a biomedical science degree at the University of Manchester from 2009 to 2012. He then went on to do medicine at Bristol, where he graduated and followed by doing his foundation training program in Wittybush General Hospital and Royal Glen Hospital, and is currently will be continuing his postgraduate training year in the Regional Hospital Victoria in Australia. All right, so on to you, Moses.
So yeah, that was a lovely presentation by Dr. Lucinda. Very, really interesting, actually. I was keen to listen into it, you know, as somebody who's planning to move to Australia. But yeah, thank you, Seth, and everyone for having me. I'm just going to load the presentation now. I hope you can all see it. Can you see the presentation screen?
Yeah.
Yeah, so essentially this presentation is geared towards those people applying for registration in Australia by the competent authority pathway. So a bit of an introduction of what I'll go through in this presentation. I'm going to start off by talking about the competent authority pathway and exactly what you do to go through it, how the application works. I'll also give you a few tips as IMGs and also as medical students on what you can do to boost your CV when it comes to applying for jobs, not only internationally, but also within this country. I'll also cover the Australian Medical Council, which is essential for getting your documents and your qualifications approved. I'll cover police clearance, that's important as well, both international and within this country. I'll also explain to you how I found a job in Australia. And then we'll cover the Australian Health Practitioner Regulatory Agency. This is essentially APRA, and they are responsible for approving registration and also giving you your provisional, and if you decide to stay for longer, your general registration within the country. And then I'll speak about my job offer in the last few minutes of the presentation. So as such, you've covered most of this. I was born in Zimbabwe and also did biomedical science in Manchester. After finishing my medical science degree, I sort of found teaching interesting. So I went and worked in a high school for about a year, and I was a science and data technician. I spent my time preparing equipment for science lessons and also timetabling students into lessons. But this was only something to do between medical school and medical science, because I didn't really want to go straight from university to another university. And whilst in medical school, I was quite lucky. I applied to work as a A&E receptionist, just to get a bit of a feel of what it's like to work in the A&E department. And this was in the pediatric hospital in Bristol. And when I got to my fourth year, towards the end of fourth year, I was speaking to one of the consultants. And when he realized I was actually a medical student in my fourth year, he asked if I wanted to be involved in the audits that he did. So I essentially then spent final year doing audits, and that was my main job. So the first audit I worked on was on collating data on pediatric head injuries and how we can predict and also prevent these from happening. This was later presented at a pediatric conference just last year. And the last audit was a pediatric patient flow. It was essentially a questionnaire that all staff members who were dealing with children in A&E filled out. And in fourth year, I did a presentation. It was aimed towards anesthetics, and it was a sleep project. And yeah, I finished medical school and started working in Wales. I wasn't really expecting to work in Wales. I wanted to go to London, but actually Wales was actually a very, very good place to go to work. I started off in a small regional hospital in Witherbush, and there I went through general surgery, A&E, and general medicine. And also F2 was then completed in the Royal Gwent. And this also coincided with COVID coming into Newport, which is one of the hardest hit areas in Wales. I started off in general medicine, and then I did a urology job with ENT cross cover. I was supposed to finish with pediatrics, and this was essentially supposed to make my portfolio more geared towards emergency medicine and pediatrics, which is what I was hoping to do. But that didn't really happen. F3, which is where I am now, I applied for a essentially bank part-time locum post in Macclesfield, and I'm awaiting to apply for my visa in order to go to work in Australia. I think a really key point to mention about any CV at this point is to make sure that you get, if you can, a presentation, a poster, and audits done in medical school, because you have a lot of time to get these things worked through. And the earlier you start, the better. And I wouldn't worry too much about which specialty you choose to essentially do your audit or presentation in. Just having this on your CV just shows that you're somebody who takes an interest in medical research and improving the work environment, and quality improvement projects are really valued in medicine. And if I move on to essentially the competent authority pathway, this is the main pathway, which mostly, I guess, UK graduates or graduates from America or and even graduates from Canada apply for work in Australia. In order to be accredited, so in order to go through, your degree has to be GMC recognized, or you have to complete the PLAB exam. Additionally, you have to do your F1 or an F1 year equivalent. This makes you eligible to apply for the MBA, which is to apply with the Medical Board of Australia to have a provisional registration. You then go forward to get a full registration if you, again, complete your full year of work. So with this application process, the more time you give yourself, the better. 6 months is, I would say, you allow at least 6 months. Most people need more than 6 months to complete this application process. The most lengthy sort of thing is the job application process. It can take quite a while to find a job. And I'll discuss this in more details later. And actually below each of my slides, I've included a link to the relevant website for you to get more information. So if we move on to, sorry. Yeah, so I think I missed a slide. No, I didn't. So yeah, so IMG tips. So again, start early. I actually started applying for jobs at the start of F2. I was looking at different recruitment agencies. I was emailing different employers, just trying to get a feel of what it's like to get a job. And what I found was many jobs asked for you to have at least a provisional registration in Australia, and also have a visa to allow you to work. And as somebody who's applying from abroad, that's quite difficult to have if you haven't completed the application process. Recruitment agencies, I think, are very, very useful. They worked for me. If you're a foundation doctor during this application process, you won't have all the time to focus on the application process. So I think it's, for me, I would say, to save yourself time and effort, and also to allow yourself to get your CV forwards, I think recruitment agencies are quite useful. They can also give you some good CV advice to help with your application. They can connect you with employers which are open to hiring IMGs. And also they can give you tips on how to improve your CV. I think the most important thing that you need to be aware of when you're applying for work in any sort of country is to know where the work is, because that will save you a lot of heartache. I think the best way, well, the way that worked for me when I was applying for jobs in Australia was I went onto the state government websites and I placed a link right there. And there you can find details of the actual jobs available in that state. The example I have on the bottom is of Queensland, and it will encompass all the hospitals in Queensland and what jobs are available. I think another thing to be aware of are the peak application times. It's usually either October to November or like March to May. I got to my job in early February, so it was right after the October to November period of time. I wouldn't worry too much about when you get your post, because there are always jobs available. I think the only little compromise is location. So of course, the big cities, Sydney, Melbourne, Brisbane, will fill up first, and they tend to fill up with local graduates. And where you tend to find the posts are the more regional places. And I guess then it becomes a sort of balancing act of, okay, so I've compromised location, I'm not in a big city. How close do I want to be to a big city? And depending on your hobbies, you know, how close do you want to be to other resources for that? An important part in any application for any job is to make sure your CV is up to scratch and easy to essentially navigate. The best structure is where you have your qualifications and your work experience essentially high up on the first page. So literally after seeing your personal details, the next point really should be your work experience and qualifications, and then your skills, because that's what really matters to employers. Another important thing that matters to employers is your exams and your registration. That's also good to put again in front if you've done any specialty exams. Your CV has to be concise. Try not to have too many long paragraphs. It's great to put it in bullet point form. the upper template, which I will attach later down the line, is quite useful. And you can just tweak it and move the sections to essentially highlight the areas that sell you as an individual, because that's how you essentially get the job. Get someone to look at it. That's probably one of the most important points with any CV, especially people who are used to hiring. And these can be consultants in the workplace, or even senior nursing staff, people who are just used to looking at CVs. And anyone in like HR can do that for you as well. And again, recruitment agencies are great for looking at your CVs and just guiding you as to where you can go and what you can improve. So if we move on to registration with the Australian Medical Council. So this is quite an important first step. So I think just a little thing to say. So your CV you can start doing before you apply for a job or before you get the job. And additionally, registering with the Australian Medical Council is something you can actually start doing before you get the job. It's quite simple and straightforward. You go on the website, which I've included as a link. You have to upload your personal details, upload your passport and a passport size picture. Also include your full GMC registration once you get it. And also you can upload your primary medical qualifications and your transcript if you have one. Just a little note, if you have any degree certificates that are written in languages other than English, it's probably best to have them translated before you upload the certificates. And I think the final part with the AMC registration is you have to have your identity verified by an external agent. And they essentially look at your face and look at your passport, and they just confirm if it's you, really. And for the whole thing, it costs around 425 Australian dollars. I suggest you sign up with the Australian Medical Council after you complete your F1 year, because it makes it quite easy to then be on that timeline of completing everything else. The next area to discuss is the police clearance. So on the Australian Medical Council website, they'll give you two options to two companies that actually do the police clearance for you. This is the international police clearance, and it's quite essential, especially if you've lived in other countries other than the UK. For longer than 6 months, you'll be asked to do international police clearance. Another thing to be aware of is with the international police clearance, you have to have proof of address, and this could either be your driving license or your utility bill. And again, it's got to be within 3 months, and also have your passport at hand. And the one that I used was Fit to Work. And again, I started applying and completing this police check, I would say around September, October time, and it costs around 159 Australian dollars. The other police check that you might need to get is the ARCO UK police check. And I guess you may be able to avoid this if you already have a CRB check that is within a year. So that's not over a year. Unfortunately, coming to the end of F2, when I was completing my upper application, my CRB check had already expired, so I had to pay for that for the ARCO. And it's quite straightforward. Again, it's essentially you submitting your address, your passport, and proof of address. And for the normal processing time of 12 days, it costs £55. And for anything shorter, so 4 days or less, you can pay 95 quid. But that's essentially quite straightforward. So the most important part really is how you find work. I think finding work in Australia is probably the most difficult part of this process. And it was good to hear that Lucinda used an agency too, because doing it on your own is quite hard. It's quite a tall task, because when you're going at it alone, you're not sure of the places that are looking for graduates from an international background. And also you're not quite sure of the sort of employers who are willing to and who are patient to wait for you to get your visa and your registration sorted. I found using an agent quite easy. I essentially went onto Google, I typed in medical recruitment in Australia and agencies. I had a list of like 10 to 20 different agencies, and I pretty much copied and pasted my CV, and then emailed it to all of them, and then waited. And within about 3-4 days, people start to call you and send you emails, and you get the ball rolling. I really got along with the Elective recruitment. I'm not sponsored by them or paid by them. I'm just, they're the agency that found me a job. They essentially, the agent, the lead agent, who was called Emma Gordon, literally spoke to me about what I was hoping to get out of moving to Australia. We spoke about the work that was available, the specialties available. And she looked at my CV and she rightly identified that with someone with the CV that I had, the sort of work that I should be applying for would be in A&E. And also the salaries as well were covered. Hobbies and interests are quite important when you're in Australia, to just juggle, to have that good work-life balance. It's pretty much why a lot of us are moving there in the first place. The final important thing was a relocation allowance. I think depending on where you're applying and depending on the employer that you're applying to, it's good to throw that in. Some employers are willing to actually give you a bit of money to help you move. I know the employer that I got a job with essentially allowed me to, I can apply for a relocation allowance of about 2,000 Australian dollars. And that can essentially cover the cost of the flights and, or even, during this COVID season, the cost of applying for a hospital, a hotel to quarantine within. I think finally, the tricky thing with the medical registration with APRA is you have to have a sponsor and a job before you can apply. And I think agencies are great at helping you with the paperwork. All I had to do was email the agency my paperwork, and they essentially did the application, and they essentially put in all the paperwork into my APRA portfolio, and they interacted with the APRA agents. So it saved a lot of time, especially when you're working and trying to juggle, on calls with applying for a visa and applying for registration. So APRA is the regulatory body, and the competent authority pathway is submitted through APRA. One important step that you need to make sure that you've done, at least about a week or two before you submit your APRA application, is to make sure that you have obtained your GMC certificate of good standing. So when I was first asked to do this, I was completely confused and I had no idea where I was supposed to go to find the certificate. But actually, it's quite easy. Essentially, once you have your GMC full registration, you can go on the GMC website. On the left-hand side, there are a list of tabs. You click My Registration, and then you essentially click CCPS requests. And then you can essentially request for a certificate of good standing to be sent either directly to an employer, or in my case, I had one sent to my agent in APRA who was dealing with my paperwork. And I also had one sent to the region I was applying to, which was Melbourne, just to make sure we've covered all our bases. The other thing you need to realize about submitting your documents, so your passport, your degree certificate, and your GMC certificate, is that they are submitted as copies, which you essentially scan and upload onto the website. And before you can upload these documents, they need to be notarized. And notaries are essentially solicitors who look at your original documents and compare them to the copies and essentially sign on the copies, stating that these documents are true copies of the originals. And just a little tip with notaries, make sure that they essentially sign the front part of your certificates and not the back, because when you're uploading these certificates online, it's better if it's front facing and if the signatures and the details of the notary are on the front of the copy. Again, I'm not sponsored by this person, but I just like the way she worked. Virginia Forswitz, she's based in Bristol. She's a solicitor. I've got her number and her email address. All I had to do was email her my documents, and she started the process off. She started signing them. I then took a proof of address and my originals to her house, stood outside. She came out, she collected my originals, went inside, compared them, and she came out with my original documents and my copies, and it was all done, notarized, and that was it. And the whole process pretty much took about 2 days and cost around £150. It's quite a lot of money to pay for this service, but speaking to people who have done this notarizing service, I've heard of people being charged ridiculous fees of £20 to £50 per page. So it can be quite expensive. So be careful who you choose. And also during this COVID season, I found it was quite difficult to find notaries because most lawyers and most solicitors weren't working or accepting clients for notarizing. So this is the UPRA CV. So it's quite important before you upload your CV onto UPRA that you structure it in a specific way. They're very strict about this. And if you don't have your CV structured in this way, they'll pretty much send it back to you and ask you to structure it properly. Again, it's the standard way of structuring a CV. And I think the easiest thing for you to do, is to start putting your CV in this format. You can always move the subheading. So for example, you can bring the work history higher up. So you can have your qualifications and then your work history to follow. And it'll make it also easy when it comes to applying for jobs. Because if you have a structure already and your structure is in keeping with the UPRA structure, when it comes to uploading your CV onto UPRA, again, it'll be easy. And on the bottom is a link to the UPRA website with the CV template on it. So you can actually use that later on as well when you're going through your application process. The UPRA application and the registration fee are both 393 Australian dollars. You're expected to pay this in one. It takes about 4 to 6 weeks for this application to go through. But again, depending on things that can happen along the way. So for me, the first thing that happened was the first person I asked to be my notary wasn't recognized by UPRA. So I had to find a different notary. And again, this delayed the process. And the second issue was my migration agent, blocked my UPRA account. So I had to then call UPRA in Australia. And this was during my on-call weekend. So there was no way I was going to do it on a Friday, Saturday, or Sunday. So I had to wait. And after I finished my on-calls, I needed some time to rest. So I managed to do it about 2 or 3 days ago. So I'm a bit behind the UPRA registration. And so I'm essentially got to wait another 2 to 3 weeks for the agent to look at my documents and then hopefully, fingers crossed, approve my registration. The other thing to note, again, yes, you're allocated an agent when you apply with UPRA. And also, if you're completing this process with a recruitment agent, make sure that you update them on all the emails that you get from UPRA, because they won't necessarily go to a recruitment agent. And yeah, just so you're all on the same page with your application. So I got my job offer from Latrobe Regional Hospital in Victoria. It's essentially about 2 hours away from Melbourne. It's a 1-year post. It's a provisional registration. It's an A&E post, and oddly, it's with a ward cross cover, which I'm quite used to doing anyway. And the ward cross cover includes surgical and medical wards, which again I'm used to doing through my previous jobs. They will sponsor my training visa, which is a 407 visa. And what I found, what's actually quite interesting, is the visa that I've been granted is a bit cheaper than the work visa, which the agencies initially wanted me to apply for. So the working visa that they wanted me to apply for, I think costed about 2,000 Australian dollars. But the training visa, which is a year visa, quite similar, is only about 310 Australian dollars. So again, I think looking at the visas that you're offered is really important. And I think what's nice about Australia is there are quite a lot of visa options that you can apply for the same job, depending on what your employer wants you to do. The other thing that they said they'll do is essentially apply for a critical worker exemption to allow me to bypass the current travel restrictions in the country, which again, I haven't quite got there yet with the application process. So once we get to the visa process, I'll know a bit more about how to navigate this area. So just to sort of wrap up, so the application process is very, very lengthy. So allow 6 months at the very least. Compile your documents early. As soon as you graduate, guys, take your certificates, take your GMC full registrations when they come through. Make sure your passport is in date. You do not want to have your passport, expiring within 2 months when you're starting this process, because it's lengthy. You need at least 2 years on that passport. Make sure your CV is structured properly. This is something you can start in medical school. And also be familiar with the Australian Medical Council and the medical registration websites. and I've put links of them on my slides, so you can access and have a read. Also, check the state government websites. When you get to like your F2 job, when you get to the start of your F2 job, check the government websites, check what what jobs are available, and you can start prompting your agent to look in those areas if you really want jobs there. And also consider using agencies, but also, I'm not saying agencies are the only way to find jobs in Australia. There are many ways, and I've heard people applying straight to hospitals and getting jobs. But again, it depends on the sort of person you are, the amount of time you have, and just how dedicated you are to getting there. So finally, guys, good luck with this process. It's quite lengthy, but it's not impossible. It's doable. Again, stay safe, and I'll start to take any questions that you guys might have. So I just have to, because I noticed a few questions coming up whilst I was talking. So how's, okay, that was okay, so IMG friendly hospitals to know if this really is easier to obtain a job. Okay, so usually with the people that I've come across, they usually ask for you to be PGY3 when you're applying for a job, but I'm not saying being a PGY2 when you apply for a job is impossible. It's just a matter of asking your employers and speaking to your recruitment agencies if you're using them to see if it's possible. Is it possible to enter specialist training pathway in Australia as an IMG, or would you after completion special training? So yeah, so special training can be a bit tricky depending on the training program you want to go into. So I think Lucinda gave us quite a good explanation that actually you don't necessarily have to yeah, I think it depends on it, because I'm not applying for special training. I'm essentially going to apply for a PGY3 job, which is on a sponsored visa. I can't comment too much on specialty training. Some training programs might need you to at least have a permanent residency before you can apply for them. And I'm going to go to the next question. Can you apply straight out of medical school? I think, again, straight out of medical school, you do need to complete your F1 year first. So if you do apply at the end of F1, you'd be looking to get a job either, well, most likely at the end of your F2 year. I think a lot of employers tend to quite like you to at least have your 2 years of F1 and F2 training. But again, if you look at the APRA criteria, it can be anyone who's actually completed F1 can apply and hopefully get a job. Yeah. So if you need a provisional license to apply for jobs, but need a job offer to get provisional license, what can you do? So my advice with this is, again, the first thing you need to do, and I think the easiest way to navigate that little niggling point, is to go through an agent. Your agent will find you a job, and they'll find you a job that's willing to sponsor you for your provisional license. But you can always find a job yourself as well. But you'd have to really, really look carefully for jobs that are willing to sponsor candidates for both a provisional license and also for a visa. So essentially, getting your job offer is the one thing you need to do. And once you have your job offer, you can apply for a visa and a provisional license. But again, some jobs do ask for you to have a full license and a visa before applying. So it's just knowing those employers who are willing to help and sponsor you for a license and for a visa. So that's a very good question. So what made you decide to work in Australia? So my brother actually works and lives in Australia, and my mum worked and lived in Australia for a few years. I really, really enjoyed it. So in medical school, I used to visit them essentially once every year during the summer period, and I'd go over there, and it was their winter, but the weather was fantastic. Used to love going to the beach, cycling, going out running, and just hanging out with the family. I just had a feel that when I was there visiting family, they had a lot more time to spend with you. My mum worked there as a midwife, and my brother works there as a mental health nurse. So I just felt like, actually, I've always wanted to sort of see what it's like to live there. Yes, so I did have to go through an interview process to obtain the job that I have currently. And it was an interview over the phone. It was at night. It was after an on-call shift. And it was an interview with a HR lady and also the A&E consultant, and they essentially asked me questions such as, you know, why do you want to come to Australia? Do you know much about working in Australia? How much do you know about our, you know, our A&E system, our 4-hour waiting time? It then slowly went into like a medical questioning, you know, type of like OSCE sort of situation, where they were asking questions such as, you know, if you've got a patient coming in with a delirium, how do you assess them? Or, you know, you've got a patient who's a patient's got a, you know, sinus tachycardia, how do you fix it? What is it? How do you differentiate between, you know, like fast AF and SVT? And what do you give to treat it? You know, and what dose? I was like, oh my gosh, this is a bit intense. But if you have completed F1 and you've completed your medical school, those questions aren't too hard to answer. And also, if you complete your ALS as well, those questions aren't too hard to answer. I think my advice, whenever you're answering interview questions which are medically related, always have patient safety in the back of your mind. And don't be afraid to tell the person who's questioning you that you don't know what the answer is, or that you would refer to something more in the UK, like a BNF, to get the correct dosage to give someone. You know, just avoid making guesses that could lead to, you know, a dangerous outcome with the patient if it wasn't in the real world. Thank you. So I started the process of applying for work in Australia at the start of F2. And I think, you know, the best thing to do, you can actually essentially start this process from medical school, depending on the sort of specialty you want to apply for. You know, if you want, for example, to go into pediatrics and to get a pediatric rotation in Australia, my advice in medical school, do some pediatric related things, do some audits, do some posters, see if you can get a pediatric job as well. You know, it's sort of straightforward stuff that you'd do for any sort of, you know, specialty program that you want to apply to. How long am I planning to stay in Australia for? That's a very good question. I think it all depends on how the first year goes. If I enjoy the first year and if everything goes well, I'll probably be tempted to come back to the UK, maybe work for a few more months, because, you know, like locuming in the UK is a bit better pay wise compared to Australia. And then, you know, maybe save a bit more and then go to Australia and see what I can do locum wise. So am I planning a permanent move, and would you need to apply for a specific visa that leads to permanent residency? Yes. So after this year, this is when I'll start to sit down and really think about it. I think if I do want to apply for permanent residency, the best way to do it, as I've been reading, is to stay in an area of need. I'm currently in an area of need. I'm in Victoria, in Latrobe. And essentially, if you want to apply for permanent residency, you stay there for about a year. I think so, it's 2 to 3 years, and you can start applying for permanent residency. I'm not too sure how that's going to work at the moment with our current situation, but it's all yet to be seen. I've heard that training positions in some specialties like surgery are only open to local graduates. Is this true? Well, I can't really answer that question, but I think the best thing to do is to go onto the training specialty websites and email the specialties directly to ask them about this. Because I think when it comes to recruitment and graduates and where the graduates are from, the best people to ask are the recruitment organizations that are dealing with the specialty training. Would you recommend doing a voluntary work experience elective in Australia? Just an idea about the work environment or help in terms of CV. So if you can, you know, get an elective in Australia, you can do that. I didn't have an elective post in Australia, but it wouldn't help to go and, you know, have a feel of the health system there and how it's like. And I think if you're going to go and do an elective in Australia, consider doing it in a specialty that you know you'd want to do as an IMG. And yeah, do you have any suggestions in finding a pediatric job in the UK if you're still a medical student like this? If you're right, I think if you're talking about a pediatric post in your foundation year, the best way to go around, I think every sort of deanery offers pediatric training, and the best way to go around this is to look at their specialties that they offer, and even speak to people who've been in that deanery to find out how they've got these jobs. I know in Wales, because different deaneries differ in how they recruit for F1 and F2 jobs. In Wales, you complete F1 and then you I think it's midway through F1, you start applying for your F2 jobs, and that's how you then, and then it's like a CV sort of thing that allows you to then present yourself in a way, forwards that you can apply for a specific specialty. Hi, when should I start applying for RMA jobs? I've just started F1. Thank you. So yeah, I think start applying for jobs at the start of F2, because as I said, just September time, start emailing people. I think that's the best thing to do. I've missed any elective questions. Will they help in IMG? I don't think electives in Australia are, a must for IMGs, because it's quite expensive to get an elective there. I don't think you should think of it as being something you have to do. And I don't think you have to, and so don't force yourself in that way. I think it's more important to tailor your elective towards the specialty that you want to then do in Australia. That'll probably help you best. But if you can, get through the visa and the application process for elective in Australia, then, and you want to, then go ahead and do it. But I don't think it's a must. Any more questions, guys?
Okay, I think if there's no more questions, yeah, we might have questions coming in as we go into the next few minutes. But thank you so much for that amazing talk, Moses. Like, it was very comprehensive. I think it was very informative, and I'm very sure that a lot of the participants would have learned a lot from your slides. I think one of the participants did ask whether would you be sharing your slides. Would you be happy with that?
Yes, I'm happy to share my slides. Can I email them to you?
Oh yeah, you can email them to me, and then we'll send it out to the participants. Yeah, no worries at all.
Yeah, no problem. No problem.
Okay. Right. I think we'll just wait for about. Oh, I think there's one question that come in. Moses, so it says, is the application process competitive, or would you say it is quite easy to find opportunities?
So again, I think for me, it's quite difficult to comment on the competition ratios, because when you're using an agency, they pretty much do all that hard work for you. But from what I've heard, yes, it is quite competitive, especially when you're applying to those big cities, which have a big demand. I think my advice is, what worked for me was using an agency. They should be free. They shouldn't charge you a penny, and they shouldn't deduct from any of your salary. I think the best thing also to make sure you check for is you can check your salary on I think there are quite a few websites which give you a rough estimate on how much you're paid within a region. And also just, your agency should not deduct anything from your salary. They shouldn't charge you anything. In fact, they should actually work towards giving you a good deal. And that's what I would advise you do, because that's what worked for me. And it actually made the process a bit shorter for me. Because all I had to do was email the agency. They found me a job. So I spoke with the agent in, I think it was December. Come January time, she had a job for me. Come February time, I had a job offer. And that was it, really. Took it from there. But again, yeah, it varies.
Okay, that's great. One of the questions that we've got, it's not a Zoom group chat, but it's from our Facebook. One of the questions that people have asked is there sort of like a specification, like similar to what you'd see in the CST application? So for example, sort of like if you have done this, then we give you a certain number of points and so on and so forth. So like publications, presentations, teaching, and research.
So unfortunately, no. Again, this is all quite specific to a specialty that you're applying for. I was, aiming towards A&E. So I managed to tailor my CV from early on in medical school towards A&E and emergency medicine, and also F1, having done an A&E job kind of helped. So it's sort of simple things like that. But the one thing I have to say is doing some teaching, getting an audit and getting a presentation will not harm your application at all. It'll only advance it. And I think there's one saying that our application process can only start from GMC qualification. Does that mean I can only start applying after FY1? So in a way, there are things that you can do in F1. Again, CV work, structuring your CV before you even start applying for UPRA. And the other thing that you can do is familiarize yourself with the Australian Medical Council and how to upload your documents, and also the documents that you need. Things like compiling your documents, you can start doing early as well, and they can only help you in the process.
Okay,
Any-
okay. Another question is, does the 10-year moratorium apply to hospital doctors or is it just GPs?
See, that's a very good question. Unfortunately, I haven't got there yet to comment on it. From my understanding, I think it might just apply to GPs. But again, I can't comment too much on that.
Okay. All right. Oh, and we've got another question that says, is it true that you have to do initial placements in Aboriginal communities before working in the city?
So the reason why I'm in quite a regional area is mainly because simply it's quite difficult to find jobs in the cities. It's really competitive. And I didn't mind being in more regional area. And again, working with Aboriginal patients is something I've been interested in anyway, and I didn't mind. So I think depending on what you want and where you want to work, you might need to consider working on the outskirts of a city as opposed to being within a city. But again, if you're lucky enough to find a post within a city, then go for it.
Okay, that's great. And I think we have just one last question, if that's okay with you, Moses. So one of the questions that's come in is, how is your pay worked out? Is it similar to Lucinda in GP?
So there are some standardized pay ranges per region. I think Queensland pays the most for IMGs, and it's all based on your year and how many years you are graduating. And they give you a sort of like a baseline salary. So for me, starting there as PGY3. The offer that I received was, I think it was 89,000 for working 38 hours per week, I think. Yeah, 38 hours per week as my base working hours, 89,000 for the whole year. And I think that comes out to a weekly salary of like 3,700 something Australian dollars per fortnight, sorry. And so that's how they sort of work out your salary. And when I compared it to what I was earning in the UK, that was significantly more than what I was earning whilst doing an F2 job and also doing on-call hours and averaging about 48 to 50 hours a week. So the pay is quite a lot better. The other thing that I managed to get on top of my salary package was a relocation allowance of 2,000 Australian dollars, and that's a package you can claim from your employer, especially if you're coming from abroad, especially if you know it's going to be quite expensive. And again, being a junior doctor, you don't have all the money. You need all the help you can get there.
Okay, that's great. And I think there's just another question that's
Yeah.
coming. Are you happy to take one more? Because I understand you're
no problem.
Okay, great. So one of the questions is, does the scheme still exist where you can work in a super regional area to decrease the 10 years to 5, or has that been scrapped?
Oh, I wouldn't know about that, actually. I think that's probably best to pass through the people who are recruiting. Either your employer, if you find one, or a recruitment agent can answer that question. I'm not too sure about it. And again, it depends on the specialty that you're applying into and the sort of work you're doing.
Okay, yeah.
Okay.
All right, sure. I think if that's it, then thank you very much for all that has come today. Thank you so much to Moses, who has spent his evening.
Thank you so much. Oh, there's one more question. Are there any exams you have to sit, such as USMLEs in the States? So no. So the plus side of applying via the competent authority pathways, you do not sit any exams as a UK medical graduate if you're eligible for that pathway. That's why I went for it. You essentially have to go through the visa application and the medical registration process. And once you get to Australia, you're then required to work for about a year full-time in that role. And that allows you to then apply for general registration with APRA. And once you have your general registration with APRA, it opens doors towards either doing locum work, or if you want to, pursuing specialist posts. But again, specialist posts and visa requirements and citizen requirements are quite complicated. And I don't know much about that, unfortunately.
All right, that's fine. Okay, yeah, and I think that's pretty much about it. Thank you so much once again, Moses, for all the questions and your slides. A lot of people have given very, very good feedback. And for those who are still listening, we will actually email you a feedback form at the end of this, which will be very useful for the speakers and for us to understand the areas of improvements which we can focus on, and also what went well with the whole session. So thank you very much. And we look forward, for those of you who aren't familiar with the whole webinar series, so this is a series. We'll be covering other countries such as Canada, US, Malaysia, Hong Kong, and Singapore over the next few weeks. So do keep a lookout on our social media pages and do sign up to our mailing list to get the registration links.
Fantastic.
Mm.
All right, thank you so much, guys. And yes, I'm happy to grab beers with people. Just send me an email. Anyway, so because I'm officially unemployed technically, so I've got all the time in my hands, but at the moment I'm trying to move house. I'm moving back to London. But anyway, thank you guys for having me. It's been great doing this webinar. Thank you.
All right, okay. Thank you.
Thank you.
Thank you.
Thank you. Bye.
Thank you.
Okay. Oh. Dude, can you please stop coming in, please, Moses?